and welcome. My name is Khushbu and we are back with another episode of Health Mantra with leading professional experts from across the state. Today I'd like to welcome Dr. Sunny Kamat. Dr. Kamat is a consultant in spine surgery. Doctor, thank you so much for accepting our invitation. It's a pleasure having you here.
Thank you, Khushbu.
So today Dr. Kamat will help us understand the problems of osteoporosis and sciatica, which is faced by many amongst us in their old age. So doctor, when we say osteoporosis, that someone is suffering from osteoporosis, what exactly does that mean?
Khushbu, if you take the word osteoporosis, it is divided into two parts. One is osteo, म्हणल्यार bones, and porosis. Porosis means weak bones. जेन्ना आमचे बोन अशक्त जाता ताका आमी ऑस्टियोपोरोसिस म्हणटा. सो ऑस्टियोपोरोसिस जावपाचें कारण खूब आसता. मेन कारण म्हणल्यार आमच्या बोन्सान एक वेरियस मिनरल्स आसता. सो फॉर एग्जांपल कॅल्शियम, मॅग्नेशियम, फॉस्फरस, this makes our bones strong. So when we lose this mineral for some reasons, our bones becomes weak. That is called osteoporosis.
Okay. And doctor, what causes osteoporosis?
Osteoporosis, the main two causes for osteoporosis is one is old age. म्हणजे आमचे वय जशें वाडटा तशें आमच्या आंगान कॅल्शियम जमा करपाची कॅपॅसिटी सवका कमी जाता. सेकंड मेन रिजन इज युजली सीन इन विमेन. बायलांनी जेन्ना पळय मेन्स्ट्रुएशन मासीक पाळी आसता पळय जे बंद जावपाक सुरू जाता तेन्ना इस्ट्रोजन तांच्या आंगान कमी जाता. इस्ट्रोजनाचो मेन रोल आसता टू मेंटेन कॅल्शियम बॅलन्स इन विमेन्स बॉडी. सो जेन्ना इस्ट्रोजन कमी जाता सो बायलांनी कॅल्शियम मेंटेन करपाची कॅपॅसिटी कमी जाता. सो ऑस्टियोपोरोसिस बायलांनी चड दिसून येता आनी बेगी दिसून येता दादल्या परस. सो हे दोन मेन कारण. दुसरें कारण म्हणल्यार एक तर व्यसन. जे लोकांक व्यसन आसता तातूंत फॉर एग्जांपल जे आल्कोहॉल सोरो पिता तंबाखूचें सेवन करता तातूंतय ऑस्टियोपोरोसिस जाता. सो तातूंत ऑस्टियोपोरोसिस जावपाचें कारण म्हणल्यार जेन्ना आमी सोरो पिता आमच्या आंगान लिपिड्स वाडटा. लिपिड्स म्हणल्यार फॅट, चरबी. सो ती लिपिड्स ते आमच्या बोन्सान डेपॉझिट जाता. सो बोन्सान भितर कॅपॅसिटी आसता टू डेवलप न्यू सेल्स. सो that space is occupied by this lipid. So bone डेवलप करपाचो कॅपॅसिटी सवका कमी जाता. सो ताका लागून अल्कोहोलिक्स आसता पळय तातूंत ऑस्टियोपोरोसिस चड दिसून येता. दुसरें म्हणल्यार तंबाखू जे सेवन करतात. टोबॅको वॉट इट डज इज दॅट तो टोबॅको ब्लड वेसल्स आसता ते मायक्रो ब्लड वेसल्स आसता ते ब्लॉक करतात. सो एकदां ब्लड वेसल ब्लॉक जालें म्हणटकीर न्यूट्रिशन आमच्या बोन्साक पावना. सो न्यूट्रिशन एकदां पावपाचें बंद जालें तशें बोन्स सवका स्लोली वीक जावन ऑस्टियोपोरोसिस दिसून येता.
And doctor, what are the risk factors in this?
So as I told you, there are various risk factors. For example, weight. People who have lot of body weight, overweight, it is seen in those patients. Secondly, who are underweight, malnourished. Osteoporosis is also seen in this. So two extreme. One is overweight and low weight. You should not be either overweight or obese, or you should not be underweight. So underweightaचे कारण because of lack of nutrition. So when you are having lack of nutrition, so that naturally तुमचे जे आमचे जे बोन स्ट्रॉंग करपाचे जे धातू आसता कॅल्शियम मॅग्नेशियम ते कमी प्रमाणात पावता. ताका लागून ऑस्टियोपोरोसिस तातूंत दिसून येता. दुसरें म्हणल्यार ओवरवेट आसता पळय तातूंत चरबी चड डेवलप जाता. सो चरबी चड डेवलप जाली ते बोन्सान चरबी एक्युमुलेट जाता आनी ऑस्टियोपोरोसिस तातूंत दिसून येता. दुसरें म्हणल्यार आजकाल आमी चडशे डेस्क जॉब चड करता. एसीन चड आसता आनी बसून चड आसता. सो भितर घरान चड टायम स्पेंड केल्ल्या कारणान आमकां सनलायट मेळना. आतां जेन्ना पळय सनलायट आमच्या स्किनाक टच जाता सुर्याची किरण तातूंत विटामीन डी सिंथेसीस जाता. सो विटामीन डी इज व्हेरी इम्पॉर्टंट फॉर आवर बोन हेल्थ. सो विटामीन डी जर कमी आसा नो मॅटर हाव मच कॅल्शियम वी टेक ते कॅल्शियम आमच्या इंटेस्टायनांतल्यान ब्लडसान पावना. सो विटामीन डीचें फंक्शन कितें आसता टू टेक दॅट calcium from our intestine and put it in our blood. सो एकदा ब्लडान पावले म्हणटा कॅल्शियम इट गोज इन एंटायर बॉडी एंड स्पेशली वेर इट इज रिक्वायर्ड इन बोन्स. दुसरी म्हणल्यार आमी बसून जर चड रावले जाल्यार आमची मसल्स वीक जाता आनी बोन्साचे कमी स्ट्रेन येता. आमच्या बोन्सान दोन तरेचे सेल्स असता. एक असता ऑस्टिओक्लास्ट म्हणटा ताका आमी आनी ऑस्टिओब्लास्ट. ऑस्टिओब्लास्ट इज अ गुड सेल, ऑस्टिओक्लास्ट इज अ बॅड सेल. सो जेन्ना आमी वेट बेरिंग एक्सरसाइज करना बसून रावता तातूंत ते ऑस्टिओक्लास्ट एक्टिवेट जाता आनी इट्स अवे द बोन. सो वी शूड ऑलवेज डू एक्सरसाइजीस. सो तातूंत कितें जाता वेट बेरिंग एक्सरसाइज जाले म्हणटकीर बोन्साचेर एकदा स्ट्रेन पडलो म्हणटकीर the osteoblast म्हणटा the good cell they activate and it starts forming bone. So these are the main reason apart from the menopause and old age.
Okay. And doctor, when do I know that I need to consult a doctor? When should one exactly understand that, you know, it's
Exactly.
okay, I need to now go and see a doctor?
Exactly. So Khushbu, what happens there are various symptoms for osteoporosis. One of the commonest symptoms is fracture. So if you develop fracture, the commonest symptoms what you will experience is the severe pain. Fracture can happen in your spine, it can happen in your hip, it can happen in the wrist, in the leg, anywhere. So जर तुम्ही चलता चलता पडली, सादो फ्रॅक्चर जालो, कांय करनासतना अशें घरा कडेन पडली, ते सिंपल इम्पॅक्टान फ्रॅक्चर जावप म्हणल्यार तुमचे बोन्स सामके वीक जाल्ले आसा. So that is the time you have to see the doctor. Secondly, you must have heard people saying की आज पयली पेक्षा आतां टायर्डनेस वाडटा, नॅक पेन जाता, बॅक पेन जाता, वजन उबारपाक जायना पयली भाशेन आनी रोखडे टायर्ड जाता. सो दीस आर द अर्ली सिम्पटम्स ऑफ ऑस्टिओपोरोसिस. सो इफ यू एक्सपिरियन्स एनी वन ऑफ दिस यू हॅव टू सी द डॉक्टर.
And doctor, what are the treatments available for this?
Okay. First of all, prevention is better than cure. So it is always better to prevent osteoporosis than having osteoporosis, because once you develop osteoporosis, सगळे problems सुरू जाता. So it is better, you know, if you treat the fracture early rather than having osteoporosis early rather than having a fracture. एकदा फ्रॅक्चर जालो म्हणटकीर द लायफ एक्सपेक्टन्सी ऑफ अ पेशंट स्पेशली इन एल्डरली कमी जाता. कित्याक कमी जाता? बिकॉज तांकां ऑलरेडी डायबिटीज आसता, ब्लड प्रेशर आसता. फ्रॅक्चर जाल्ल्या कारणान तांची एक्टिविटी कमी जाता. सो ते बॅडार तांकां बॅड रिडन जातात ती. कित्याक बॅड रिडन जाले म्हणटकीर बॅड सोर जाता, चेस्ट लंग इन्फेक्शन जाता. सो आनी सर्जरी सुद्दां त्या एज ग्रुपान इट इज लिटल कॉम्प्लिकेटेड बिकॉज ऑफ द अदर कोमॉर्बिडिटी म्हणल्यार associated diabetes, blood pressure. Okay. So to prevent osteoporosis or to treat osteoporosis, there are various types of treatment. The commonest is calcium, bisphosphonate and teriparatide. Ata bisphosphonate is a medicine. It can be taken orally, that is tablet or injection. Tablet orally घेवपाक it is usually started early, especially in menopausal women. बायलांनी पयली स्टार्ट करता आनी तातूंत कितें जाता की it is safe, mostly it is safe and it is economical. But some patient don't tolerate oral medication because of acidity, gastritis. In that patient what we give is injection. So injection can be taken once in a year and once in 6 months. There are two types of injection. So once in a year injection घेतात तातूंत मातशे सायड इफेक्ट चड आसता. आतां ते लेटस्ट इंजेक्शन्स आयल्या which can be taken once in 6 months, which can be taken for almost 10 years. Those are relatively safe. So another medicine is something called as teriparatide. Teriparatide is a hormone which actually starts forming new bone. So this is given in a pulsatile doses. Pulsatile doses म्हळ्यार daily ते एक simple injection आसता ते घेवचें पडटा. It is not painful. Very minute dose आसता. It comes in a pre-filled cartridge. आणि ते daily घेतकीर at least minimum 6 months घेवचें पडटा. Maximum can be taken for 2 years. तातूंत bone develop जावन bone strong जाता. आणि lastly calcium and vitamin D3. Calcium, definitely we have other sources. You can take calcium tablets, supplements, Also, you can take calcium in the form of in food, dairy products, green leafy vegetables. These are the good source of calcium, phosphorus, and minerals. Vitamin D3, of course, the major source is exposure to sunlight. So you should make a point that at least you should go outdoor and work out, especially in the morning. So the sunlight between 9 to 1 p.m. is best for our health. So any other sources of vitamin D3 is mushrooms if you are vegetarian, fish oil which has good omega-3 fatty acid and vitamin D3. And of course you have to maintain a good diet, balanced diet, especially there should be good amount of protein in your diet, and you should decrease fatty foods, processed foods, especially fried foods. Definitely it helps.
Okay. And doctor, what exactly is sciatica?
Okay, sciatica means sciatica is a first of all there is a nerve in our body. This nerve is the biggest nerve and which goes from our back to our leg. So now the main function of the nerve is that it carries signal from our brain. So if I want to move my foot, if I want to move my leg, or someone has touched my leg, so that signal is carried by the sciatic nerve. So any inflammation of that nerve is called sciatica. Or when the nerve gets compressed and you start getting pain which is radiating from your back to your leg, कमरेंतल्यान दूख आमचे पांयान वचपाक लागता, कमरेन कितें कंप्रेशन जर जाली जाल्यार ती न्हू जाल्यार ताका आमी सायटिका म्हणटा.
And doctor, what causes sciatica?
Sciaticas, the major cause of sciatica is disc prolapse. आता आमच्या बोन्स असता पळय मणक्यान, स्पायनल कॉर्डान, there are bones. Between these two bones there is a structure called as disc. A disc is nothing but like a cushion. So तातूंत भितर एक जेल असता. So आमी जी routine activity, daily activity, jumping कितें करता पळय, तो it absorb all the shocks. So केन्ना केन्ना जर if the gel comes out because of any injury or lifting anything heavy, so these gels comes out and it can press on the nerve which is there just right behind the behind the nerve. So the कमरेन जर nerve press जाली, you can feel the pain going down from your back to your leg. Of course you'll also get a back pain for that. This is the most commonest cause of sciatica. Another commonest cause of sciatica is especially seen in older age group because of osteoporosis. हाडां आमची झरपाक सुरू जाता. जशें आमचे नी जॉयंट आसता पळय तसो आमच्या स्पायनल वर्टिब्रल कॉलम मणक्यान सुद्दां बोन्स आसता, जॉयंट्स आसता. ते एकदां झरपाक सुरू जाले म्हणटकीर तांच्या सायडीतले मांस वाडपाक लागता. मांस वाडले म्हणटकीर थंय नर्व आसता ती कंप्रेस जाता. ते एकदां कंप्रेस जाले म्हणटकीर पांय दुखता. तुमी आयकलां आसतलें की पांय चलले म्हणटकीर जड जाता, पांय मूं येता, असलें सगळें लक्षण सुरू जाता. सो दिस इज द टू मोस्ट इम्पॉर्टंट कॉज ऑफ sciatica.
And doctor, say if I'm suspecting that I have sciatica, what are the symptoms I need to look out for?
Okay, so the commonest symptoms of sciatica, first thing you'll have back pain. Okay, second thing you'll experience a pain radiating from your back to your leg. म्हणल्यार एक कमरेतली दूख तुमची पांयान देंवता, shooting kind of pain, आनी तुमकां अशें शीर व्हडल्या भाशेन sensations येतले, आनी it's like pulling sensation, a nerve pulling kind of sensation in your leg. It can be in one leg or it can be in both the leg, depending upon where the nerve is involved. And associated symptoms like you'll feel burning sensation in the leg heaviness. If you sit for too long, if you walk for too long, you might feel that leg has become more heavy, it starts aching. So these are the common symptoms of sciatica.
So again, doctor, here also if I want to consult a doctor, how do I know that I need to, that it's time I should consult a doctor?
Okay, so most of the time, if the compression is minute, it gets relieved on its own, like with anti-inflammatory or painkillers. 80%, 70 to 80% of the time, the symptoms get relieved with the medicine. So तुमकां जेन्ना पेन चड जावपाक लागलो, तो इवन होम रेमेडीज करून जर थोडे दीस रावन तुमचो पेन जर देंवना, and if the pain is really bothering you, then you have to see the doctor. Secondly, if you feel that your leg has become weak, the numbness has increased, you are not able to walk properly, you are not able to sleep properly, then you have to consult a doctor.
And doctor, are there any treatments available?
Yes, of course. See, we have something called as minimally invasive spine surgery. So तातून कितें करता आमी, we decompress the nerve which is been compressed. Of course, we try medicine before going for surgery. We try all the medicine like neuropathic medicine, analgesic medicine, and if the patient doesn't respond to this, only then we counsel the patient for surgery. So this the surgery what I'm explaining to you right now is a very it's a new technique in which the incision of the surgery is very small and there is no bleeding, minimal bleeding. There is absolutely no pain after the surgery, and you just need 24 hours. Within 24 hours, patient can be discharged from the hospital. So the advantage of this kind of surgery is that it can be used in an elderly patient in which we cannot do a major complex surgery. So it actually does the work of a major surgery with a small incision and with a minimal collateral damage to the tissue of the patient.
But is it safe for patients in old age to undergo this
Yes,
surgery?
in fact, it is safer because conventional surgery or traditional surgery, what they used to do in past, in which they used to put a bigger incision. There used to be a lot of tissue dissection, more morbidity, more trauma to the patient. Recovery was delayed. There was major blood loss. Infection was more common in those kind of patients because they already have less immunity, and diabetes as well. They also suffer from heart issues, lung issues. So in this kind of surgery, what we do is that we do the same surgery with a small incision with minimal host tissue trauma, and the recovery is very rapid. So the patient, as I told you, walks on the same day of the surgery, and we can discharge this patient within 24 hours from the day of the surgery.
So doctor, do you have anything for our audiences you can help them, prevent osteoporosis or sciatica?
Yes, definitely. I would advise my audience first of all, if you are addicted to any of the substances like alcohol and tobacco, you should stop it completely. The reason I have already told you. Secondly, you should do more of start doing more physical activities like walking, weight bearing activities like walking, and weight training activities like strengthening your muscles, and of course exposing yourself to the vitamin to the sunlight, so that we have ample amount of vitamin D in our body, and also having a good balanced diet which is equal in carbohydrates, proteins and other minerals. Include more of green leafy vegetables in your diet. Avoid processed food, fried foods like burgers and fries. And definitely, if you experience any of the symptoms of osteoporosis which I had mentioned before, you should consult a doctor as soon as possible.
Thank you so much, doctor, for taking the time out, coming here and advising us on this. Thank you so much.
Thank you.
So, if any of you are experiencing any of the above symptoms and wish to consult Dr. Sunny Kamat, he's available at Manipal hospitals from Mondays to Saturdays. See you again soon. Until then, eat healthy, drink plenty of water, exercise daily, and take sufficient sunlight.